Hi, Dr. Brinson. My name is Emerson. I'm presenting to you this patient who is in the emergency department right now and we're gonna be admitted. Anyway, this is patient's name is Mackenzie Sawyer. She's a 21-year-old female college student. Was brought in by her boyfriend this evening, and apparently she had like abrupt shortness of breath, difficulty of breathing and speaking, and that began minutes after eating sushi and shrimp tempura, and then presented 25 minutes to 40 minutes in the emergency department. um, she reported that it is a sudden onset of respiratory distress, and then she can feel is her throat is like swollen, and so she presented. She did not say anything. She did not take anything that it will gonna alleviate it, but she just like came in right away. She did not have any uh, nothing that made it worse or made it alleviate. She's not taking any medication. She's allergic to penicillin, and this started when she was still young, and she doesn't know what's the allergic reaction. Right now, where I'm putting in that she's allergic to, like probably shrimp and sushi. She has no past medical history and surgical history. The only thing that I have seen in her physical examination is that there is rash to her arms and legs. That's what she said. And then she had nausea. When she came in, her vital signs were all okay except for her saturation that is like at 92% at 2 liters. And when we placed her, I'm sorry, it was 92%, starting at 92%, placed in 2 liters, and she became better after that. Epinephrine subcutaneous 0.5 milligram was given to her times 1, and she felt better. And then I gave Benadryl and steroids to accompany it so that there will gonna be no reoccurrence of allergy. Um, like what I said, all the vitals are okay. She looks better now, and we did some labs. Her AKG is like what heart rate is 130s, and sinus rhythm, no ectopy or anything in her AKG. CBC and BMP was done also, and everything was normal. I would say eosinophil. I did not notice the eosinophil, but I would say eosinophil was kind of like on the higher, a little bit on the higher side. Um, just looking here. No other pertinent review of systems and physicals, but I'm going down now to the differential diagnosis. I think this is a anaphylaxis, and this is also accompanied by angioedema that is like caused by the allergy, caused by eating shrimp and sushi. So other diagnosis will going to be tonsillitis, but opening her throat. The tonsils are not swollen. Could be also a panic attack, but she was not hyperventilating when she presented to the emergency. So we can roll this out. I think my working diagnosis right now is anaphylaxis and angioedema, primarily because she responded to the epinephrine subcutaneous administration like minutes after giving it. Um, Basically, the plan of care will gonna be just like give we also I'm sorry we also gave albuterol 2.5 and 2.5 via nebulization, but she was doing better with it already when we gave it. um like what I said, we did steroids, Solucortef 80 milligrams IV, and then Benadryl times 1 IV 25 milligrams, and then right now supplemental oxygen is still running for her just to keep her saturation above 92%. We can win her off from it, and I'm considering like giving doing chest x-ray, but withhold it. But if the angioedema or probably anaphylaxis will gonna come back, then I'll gonna be ordering some chest x-ray for this patient. For now, I think it's not necessary. um Basically, we'll just keep her for like few hours here because angioedema and anaphylaxis could happen again. And so uh for now, just like to monitor her. um I also noticed that her blood pressure was like sorry 140 over 90. Basically, I think this is because when we gave her the epinephrine, I think this is just a result from that medication. But other than that, this can be treated outpatient by her primary care physician. For now, what we can do is just like educate the patient to avoid eating sushi and shrimp and to prevent recurrence. um, I think that's all. Unless you have anything to like add or anything to the plan of care, I would gladly like add it to our, to this plan. If you have any questions, just let me know. Thank you.